with us today, we have a very young person, Dr. Siddharth Aggarwal, and he has a doctorate in orthopedics, which is a degree beyond the MS, and he's an expert at arthroscopy and sports injuries and sports surgery. So he's also a faculty at several conferences and workshops. And since he is a specialist in sports injuries, we invited him to tell us what precautions we can take for the prevention of injuries during exercise and sports, like even walking, jogging, running, and even yoga. As I understand, most of these sports injuries, so-called, which go to the sports injuries specialists, arise from yoga. So we will need to know what is it that we are doing wrong. So welcome, Dr. Siddharth.
Good morning, ma'am. We're talking about injuries during exercise, all sorts of injuries. So the basic principle of an injury is to train your body for the particular exercise. No exercise is out of your range and no exercise is easy. That's what we need to understand. We just need to be trained rightly for a particular form of exercise. Even an 80-year-old can do a marathon, and a 20-year-old may not be able to run for 2 kilometers. It's just about how well and how correctly we train ourselves to do the job. So most common injuries, I'll just have a small background that we face are accidental injuries. They are due to improper form or inadequate warm-up. That's the most common problem. Overuse injuries, excessive workouts. When we start any form of exercise, we have people pushing us, or we have a self-motivation that we want to have more and more in lesser time. So that's one of the most common causes. Then what are the principles of any exercise? One, you need to have a proper warm-up and a proper cool-down interval before and after the exercises. You have to practice proper form and posture. Wear a good pair of shoes which is suited for your form of your type of exercise, whether you're doing yoga or jumping or running or Pilates or any form. Use a mat while you have practicing exercises on a floor so that you don't slip. Don't push yourself too hard. You should push yourself, but not too hard. And give time to your body to recover. It's not a machine that you can just switch it on daily and daily and daily. You need time off in between. You have to understand this. What's the prerequisites? As I told, warm up, stretching, taping and bracing depending upon the type of exercise you want to do. Suitable environment. You can't practice Zumba or a dance practice in a closed room. You need to have adequate space. Appropriate training, somebody guiding you well through the exercise regimen, and the equipment if required, as per your body habitus or what your capacity is. So let's start with the most important part, that is a warm-up. What is the advantage? It increases the blood flow and increases the flexibility. The more the muscles are flexible, the lesser they are liable or have a chance of injury or stretching. So how much should you do it? You should do it so that you have mild sweating, but don't feel tired. And an effective warm-up lasts for around 30 minutes. So don't start it too early. Just start it like 10 minutes before the exercise, 10 to 15, 10 minutes warm-up, and then you can go on to your main exercises. Stretching. The most important, the most neglected. I always tell my patients, whether you do regular strengthening exercises or not, do not neglect stretching. The simple PT that we used to do in school, that's a very good form of exercise, stretching exercise that we can do 10 to 15 minutes a day. Otherwise, the regimen is 5 to 6 times a week, 2 to 3 repetitions of each stretch, and hold on to a position for 10 to 20 seconds. How much should you stretch? Intensity of stretch should cause a mild discomfort, but not cause you intense pain. These are the common stretches. Pectoralis, that is the chest muscle stretch, the wrist, the upper trapezius, the hamstrings, the quads, the calf stretches. If you realize, we start from top to bottom, right from the neck, the shoulder, the hamstring, the calf, the quadriceps, then the back stretches, that is the piriformis, knee to chest, and rotations. These are the type of bracing and tapings that we can use in order to be safe from various injuries. Progression. This is one of the very, very important part. How much and how soon? Suppose you start with a cycling with 10 minutes. So next week, you feel that you can increase 15 minutes. Next week, go to 20, 25. That is where the problem starts. So once you have achieved your basic level, you feel that this much I'm comfortable with. Then the progression should be 10 to 15% increase in either, it's either intensity or load or duration, either of the three things per week is the ideal way of progression of exercise. Too fast, too soon is the recipe for disaster. Suitable environment, as I told you, there should be adequate space and a stable flow. Appropriate training, any new form of yoga, dance, high intensity exercise should be started under supervision and should undergo progression according to the supervisor. A simple stretches or a simple form of walk or slight running can start and continue by self, but yes, a proper form of exercise which involves intense activities should be supervised. Proper equipment, you should wear comfortable or exercise specific shoes. Running and walking, even morning walk, should be on a flat surface. We experience so many injuries walking on uneven surface. Ideal is a flat mud ground. In case we don't have a even surface ground, a road surface is better or a pavement is better than an uneven surface. Use of yoga mats and knee pads, etc. Adequate hydration. We all lose fluids when we exercise. We all understand that. It's a sweat, it's a breathing, it's the general evaporation. So we need to appropriately replace that fluid along with the electrolytes. So approximately 200 to 300 ml, that's a glass of water, every 15 to 20 minutes for a medium intensity exercise is required, like cycling. And it should contain electrolytes and some part of sugar, some salt, some lemon, and some amount of sugar to provide a good hydration. Cool down, most neglected and the most important part, more important than warm up. Transition from intense physical activity to a more typical activity level should always be done. It allows the heart rate to return to its resting state. Rehydration is an essential part. You should rehydrate yourself. And typically, the moderate intensity, 20-25 minutes of exercise, or 5 to 10 minutes of cool down is sufficient. What are the warning signs you should be worried about? Persistent joint pain. I'll use the word persistent. Any pain lasting more than 48 hours, even with rest and icing, should be considered. Tenderness at a specific point, any point you feel that this point is specifically more tender, or a persistent swelling more than 48 hours. 48 hours you can observe. Reduced movements, comparative weakness, you feel there's a weakness in your hand or a tingling or a numbness. These are the basic warning signs of any exercise. So what's the take-home message in exercise? You have to develop a fitness plan that includes cardiovascular exercise, strength training, and flexibility, all three. That is the cardio part, somewhat strengthening, and flexibility. This will decrease your chance of injury. Injuries are better prevented once you have, then they bother and keep you out of action for a significant period of time. So your focus should always be to prevent injuries. Alternate exercise, different muscle groups. Don't keep on doing the same exercises, same muscle groups day in and day out. Warm up and cool down properly. Stay hydrated. Don't work out when you are stressed, tense, preoccupied. Just try to have a proper time bound that this much time I can keep for myself. Stretching exercise improves the ability of muscles, and thus we can reduce significant number of injuries. In fact, early injuries can very much be corrected by stretching. So stretching is an integral part. Use of right equipment and gear, and rest when tired. Do not push yourself. A basic thing I always tell all my patients, all my friends, do not exercise through your pain. Your body is telling, it's a mechanism of informing you that something is not right. We need a break. We need to stop. So do not push yourself that much and do not exercise through the pain. So far as the slideshow was concerned, this is done. I'll now demonstrate a few of the common stretches that we all need to know. The most common form of pain that we exercise in our profession is the neck pain, partly due to the consistently reading habits or focusing in a particular direction. So, and essentially, all of us as the time progresses are bound to have some sort of cervical spondylitis. So, first of all, the stretches for the neck. Neck pain is a association of the neck muscles and the upper shoulder and the scapular muscles. So we go with the neck extension. We go possible, as far as possible with your eyes closed. Maintain that position for 5 to 10 seconds. You should just take care that your eyes are open. Sorry, eyes open. I said eyes closed. Eyes should be open so that you don't feel vertigo. Many times people start having a feeling of vertigo, so prefer to keep your eyes open. Second, you take your chin to your chest. Get back. Tilt your neck towards one side maximum that you can with your in a position of comfort. Then to the other side. These are the 4 basic rotational exercises. Many people do this rotational. Don't really recommend this because it can cause a lot of issues with the existing cervical spondylitis and can cause vertigo. So no rotations for me. Simple shoulder rotations. Forward to backwards rotation of the shoulder. Yes, this one helps. And simple like we used to do in school. Up, side, down, forwards, upwards, sideways, downwards. For arms in front, backwards. So this way, our shoulder and your neck muscles are very much stretched. In case you have regular pain, try to practice this every 2 hours for 2 to 3 minutes. It will be hardly make around 10 to 15 minutes, but repetitive stretching will decrease the load and decrease the intensity of pain. Once you're through with this stretching thing, your neck is comfortable, then you can add on the strengthening part. There's a set of 6 exercises, 10 seconds each exercises, 10 minutes in morning, 10 minutes in the evening. I'll repeat. Cross your hands, put in front of your forehead, give a forward pressure sustained for 10 seconds. The neck should not move forward or backwards. Just keep a sustained pressure. Then a backward in the occipital region, keep your head, keep your hands, and give a backward pressure again for 10 seconds. Then on the right side, keep your hand, sustain the pressure for 10 seconds. Try to maintain your neck in a central stable position and not tilted towards any of the sides. Then the opposite side should maintain a sustained pressure without movement of your neck. These 4 exercises are done in 40 seconds. Then the next one is shoulder shrug. Shrug your shoulders, maintain them in a shrug position. And last one is scapular traction. Try to pull your shoulders backwards. So these 6 exercises constitute the strengthening exercises for the cervical spine and should be practiced 5 to 10 repetitions in the morning and evening on a regular basis. In case your neck is comfortable. In case you're not comfortable, go for stretching. Do not go for strengthening. Go for stretching, as I advised earlier. This is for the neck pain. So far as many of us are having frozen shoulders or early shoulder issues. So in case it's a frozen shoulder sort of situation, you should try to give your shoulder maximum amount of movements upwards, backwards, as up and high as possible, and sideways. These keep your shoulder in normal movements and prevents or cures early stage of frozen shoulder. And lastly, I would like to teach some of the stretching exercises for the back. One of the common ones that we have. You can choose any flat surface. I'll try to see if I can see this. Can you see? Can you see, ma'am?
Yes.
Yeah. In this, you lie down on your back. Take one knee at a time, hold it, and pull it towards yourself. Hold this position for 10 seconds. Once you're done, you can leave this. Then the other one for 10 seconds. And third is take both the knees and try to pull them and keep them for 10 seconds. Once you're done with these three exercises, when you cross your leg, try to pull your knee to your back. This sometimes needs some assistance from other person, then the opposite part. All these stretches are ideally to be maintained for 10 seconds. Please. Lastly, the stretch of the back. Keep your hands by your side and maintain your back in an upright position for 10 seconds. These 6 exercises provide a good stretching module for your back and can be practiced in the morning when you are about to get up from your bed. So I think neck stretching, the shoulder stretches and the back stretches are some of the integral part we can incorporate for 10 minutes in our daily routine, morning and evening. Thank you, ma'am. I think that's all from the exercise part on my end. And ma'am, over to you.
That was really, really very nice. And what is very nice about all this is that we have an expert who tells us all this, because the value of anything that you say is much, much greater than anybody else saying the same thing. So, Dr. Siddharth, we have a question for you.
Yeah, ma'am.
This is from Ruchira Jokhakar. She says, Sir, can you say anything about swimming exercises, warm up, and cool down activities?
Swimming is a very safe type of exercise, I would say, because your body is not taking your legs are not taking the load. So any age group and with any BMI or any obesity level can safely practice swimming. And essentially, swimming has a very low, recreational swimming has a very, very low incidence and chance of any sort of injury. So swimming is advisable in almost all forms of as a standard exercise under supervision, obviously.
Yeah, in actual fact, whenever I have a problem and I'm not able to do my exercise regime or yoga, I do it in the water. I
Yeah.
go in the pool, and all of us, we can actually do our whatever yoga you're doing. If you do it in the pool, then your chances of injury will be lesser. It's
Yeah,
a
the buoyancy of the water takes off the load from many of the joints.
yes.
Another point I would like to add is people asking a lot about the walking as a form of exercise, especially if they are having joint pains. I have many females and males walking at between the age of 50 to 60, having early or moderate osteoarthritis, asking what sort of exercise, walk regimen they can practice. So I tell them that in walking or treadmill or running, the load of the body is coming onto your knees. So that has to be limited to a particular interval. Rather than that, other form of exercise like cycling, in which your body weight is taken off by the seat and your legs are able to exercise separately, is a preferable form of exercise more than running or treadmill or somewhat walking in case you're having a knee pain. That is one of the things I add on to this, because you're offloading the affected painful part is very important for you to be able to continue the exercise. Otherwise, that pain will increase and you'll have to break it in between. So the basic part is if a joint is complaining, your joint is troubling you, that is the body's nature's way to tell you that this is something is not right. So respect that.
Yeah, and one question that I had for you, you
Yeah.
talked about doing stretches for the back
Yeah.
uh, uh, as soon as you get up in the morning. So,
Yeah.
did you mean that we can do our back stretches on our bed?
Yeah, ma'am, you can. Ma'am, see, I'll tell you something, a very interesting thing. We have
Yeah.
everything in market related to doctors. Like we have ortho mattresses, we have orthopedic shoes. You know, everything is being sold. I just asked my patient, do you think any orthopedician has a knowledge of how to design a mattress or a shoe?
Hmm.
Or is anybody that much involved in that stuff? So these all mattresses and shoes and everything is actually being designed by various people and putting on the name of this is suggested by orthopedic surgeon. So far as the technical part is concerned, we recommend a normal soft mattress, not something in which you just dhas jate ho.
Yeah.
Just moderately firm and comfortable mattress that is good enough for your back. You don't need something very hard as a plank or something as a manja that used to give you a hammock type of effect. So a normal mattress is good enough for your all routine activities, and stretches can easily be carried out. Definitely, a yoga mat or a proper environment is more conducive, but many times it's not practical. You have a schedule, you have to send your kids to school, you have to go to your office. There are so many things at hand. So taking time additional to that in morning sometimes becomes a difficulty. So if you can do stretches 5 minutes in the bed, still better than not having them at all, and it's safe. Stretches in bed is safe. There's nothing wrong with it.
There is, we'll come to some of the questions from the audience, but
Yeah.
very long back, somebody had told me that you should never jump. At your age, you should not jump because of the impact of that ground on your spine. How true is this?
Ma'am, I would differ on that. I talk about the physiological age and not the chronological age. If your body is ready to take that sort of load, you're allowed to do that exercise. We have attended Olympics in which the people more than 60 years of age do all sort of sports. So how are they able to do it? Because their body is able to withhold that pressure. They're trained for that. So in case you are 60 and your spine is good, you have good paraspinal muscles, your stability is good, so you can practice exercise that involve jumping. But even if you are 40 and you are slightly on the obese side, you are a sedentary lifestyle, not very good bone density, jumping can still cause a lot of trouble in spine in that patient. So it all depends how much your body can take the load. Start with a lighter form and gradually progress so that you develop the strength and you know what your body can take. No exercise is contraindicated in a normal fit individual. It is not about age, it is not about obesity, it is about fitness.
Yes, never.
You can be obese, but you need to be fit. You can be elderly, you can be fit. You can be 27-year-old with a BMI of 25, but still not fit enough to sit for an hour in front of on a table and chair and work. So it's all about how much fitness level you have.
And walking, if you have a choice and
Yeah.
you have a mud track which is even,
Yeah.
or a hard road concrete surface,
Mud.
where would you
Mud.
advise?
Mud.
Why is that?
Ma'am, soft surface puts less load on your knees. It has a compressibility. Your foot gets less reaction from the ground when it's a mud surface. So your purpose is to have a comfortable footwear and on a relatively firm surface, not a hard surface. So mud surface is advisable in case it's even. Mud or a grass surface, that grounds we have, they're advisable in case they're even. But the issue is that evenness is always a question. There are sometimes some pothole somewhere. So we have walking tracks all around the parks in Chandigarh. That suits good.
Yeah, we have a question from Ruchira Jokhakar. Sir,
Yeah,
especially in winter, what should be warm-up exercises before swimming?
ma'am, like you can have 3 or 4 rounds of the pool before you jump in water, because most of the time in winters, the pools that you use are pre-warmed pools. They're not cold water pools. So if you have a slight warm-up of your body just by having 3 or 4 rounds around the pool, that should help you out.
Your rounds, you mean by walking or running around the pool?
You can brisk walk around the pool. You can't jump around the pool. So you can't run around the pool because of the risk of slipping. So you can just have a brisk walk,
Brisk
3 or 4
walk
rounds. Yeah.
around. And
Because injury prevention is also taken care of.
any good activities for heart and diabetes? This is a question by Beena Tandon.
Anything any exercise that does not elevate your heart rate more than 120 in a cardiac patient is good enough. You can practice walk, brisk walk, cycling, all are good.
And
My go-to exercise is cycling for any person. My go-to exercise is cycling.
And there was something I had read regarding cycling, that if you're going to choose a moving cycle,
Yeah.
rather even a stationary cycle for that matter,
Yeah.
when you cycle,
Yeah.
so is there something that your knee should not rise above the level of your hip? Otherwise, there is more strain. So your seat should be that high that your knee, when you are cycling, comes lower than your hip
Degree.
joint. Is that?
Basically, knee flexion should not exceed beyond 90 degree.
I
So
see.
your seat should be relatively higher. The 45 to 90 degrees is the advisable range of motion at the knee. If it is too down, it puts a lot of stress on the knee and hip muscles when you are pushing it. It's too low. If it is too high, it is difficult for you to paddle. So it should be at adequate height for a knee range of motion to go from 45 to 90 degrees. So
So,
automatically motion
yeah.
becomes concordant.
So your knee should not be more than 90 degrees to your body. It should not be like this.
The knee flexion angle.
Yes,
The
knee
angle
flexion.
of the knee should
Yeah.
not, yeah.
Should not be more than 90 degrees.
In
90
that
degrees.
case, your whole of the hip and the ankle chain becomes okay.
Yeah. So somebody has asked, Aruna Makhija, I had thoracic 12 spine compressed fracture in menopausal age due to fall. Please suggest exercises to strengthen my back.
Ma'am, in D12 compression fractures, the problem is the anterior wedging, that is the kyphosis, koob, जिसे कहते हैं koob nikal jana. You have a tendency to bend forward. So what you need to focus is essentially extension exercises. Lie down on your stomach and arch dhanurasana जिसे हम कहते हैं. Your head should be raised and thigh should be raised. Try to have back extension. That reverse of koob, ulta.
Yeah.
That
Yeah,
is
like
we need to work on the back
Bhujangasana.
muscles.
Can I just add something, Nirja, over here? Doctor,
Yeah.
do you think, can I add another point, very important point
Yep.
related to the kyphosis? Do you also suggest that they should not be doing forward and lateral bends for these people?
Lateral bends, ma'am, I desist patients in more than 50, 60 years of age because
Even
that
the forward bending, especially when you have had those fractures?
with after fractures, forward bending is advisable to be decreased. Decreased, but lateral bending as such in spondylitic age group should be avoided.
Should be avoided. So
Yeah.
only the stretch, this is permissible, but the forward
This
and
is
the
the
lateral
best
bend-
form of exercises, back extension exercises for an elderly age group, more than 55, 60 in the osteoporotic age group.
Why
But-
is lateral bends not advisable
It
for?
puts a lot of stress on the facet joints, both the right and the left facet joint, when we do a lateral bending. And facet arthropathy is a very common cause of pain in spondylitic spine. And essentially, we don't have much treatment options for facet arthropathy. So once if you are having age-related changes in facet joints and you do a lot of lateral bending, and once the inflammation starts, then a cycle of pain and inflammation is very difficult to break. So it's advisable if we can avoid that.
So this would be true for all those patients who even have low backaches, with which on X-rays or MRIs shows facets which have increased in size. This would
Definitely.
be true. They
Any
should not
facet
do
joint arthropathy, facet joint arthropathy should avoid lateral twisting movements.
Yeah.
And lateral bending ones. We cannot make it zero. We have to understand we live in a world and we have to do all sort of activities. We can decrease as much as possible.
Okay. And Dr. Beenal Shah questions, what is the physiological age concept? No, she just writes here, physiological age concept is very appropriate. This is her comment about this. Beena Tandon asks a question, skipping. She's asking.
Skipping again, ma'am, involves jumping. If you have a back pain or a knee issue, jumping exercises are relatively not very comfortable because they can increase either of the two issues. Otherwise, skipping, if done on a regular basis and training your body, is a very good form of exercises. It's a very good form of exercise. It should be started gradually and your body should be trained for that.
Yeah. And
one exercise I always tell my patients to avoid. I'll tell you the concept behind it. A normal walk, you're walking on a stable, static ground. On a treadmill, the ground is moving in one direction, you are moving in the other. You have a double reaction force on your knees and your lower limbs. So the chances of getting injuries and unusual forces on your knee is very high. So, and more so with inclines and your, motivation or people pushing you to achieve more and more, you tend to do more than what your body can take, and you end up injuring your knee. I have so many knee pains coming up because of treadmill. So I always resist rather than, stopping the urge, they may increase nahi karna. It's better to shift to other comfortable forms like cross trainers, cycling, or a very small amount of treadmill. It should not be the main exercise for you.
I think for home people who want to gym at home, begin from home gym. What is the standard teaching is to buy the cross trainer where you're moving the arms and the legs. So there was a time, maybe 10-15 years ago, we used to buy the treadmill. So
Yeah.
now the orthopedicians and experts do not.
Ma'am, treadmill is one of the very dangerous sort of exercise. I was never in favor of it.
Yeah. So we are just checking for. There is one question from Sarla Jain, which I am not able to figure out. She writes, at the age of 60, can do
Garba,
Garba.
ma'am, that is probably the Gujarati dance that she's talking
Garba,
about.
Garba.
Yeah, Gujarati dance.
Garba.
And what about knee injection?
What about knee injection? Ma'am, injection, we have 2-3 options. Few are visco supplements and some are steroid shots. Steroid shots are routinely not recommended unless there are very, very limited sort of indications. And injections are good if they're given at an early stage, that is stage 1 and stage 2 of the arthritis, early osteoarthritis. Problem is, most of the time when the patient reaches the doctor or is willing for injection, it's already beyond that. So injections have a very limited role, but essentially they have no side effects. So if your clinician feels that you may be better, there is no harm in taking a knee injection, which is a supplement, not the steroid shot.
In plantar fasciitis, Siddharth, what is the correct way to manage that? Because many of our patients have plantar fasciitis. Is it because they walk barefoot on hard floor?
Yeah, exactly. That is the cause. Ma'am, it is an overuse injury. It's an injury to the heel because of hard, repetitive trauma. So you need to offload the heel. Ideal is not to walk. That's not possible. So you need to provide a soft silicone heel cup that comes from a commercially available company. There's a pair that comes. You can put it inside your shoe. That is not practical for most of the females. So you can get it fixed on your slippers by a local cobbler. But the catch point is you have to wear it both at your home and outside. So whenever your foot is on the ground, you should have that cushion between your foot and the footwear. So your home slippers and your outside wear both need to have that. Unless you do this, it is never gonna get cured, whatever treatment you take. And if you do this, you may actually not require any other treatment and you can get cured just by use of the silicone heel.
This is a very important message because most of us, we feel that the more barefoot you walk, the better
it's good, but once the pain starts, once there's an injury, then you need to treat it. And second thing, ma'am, what I want to tell about this plantar fasciitis is many of us are buying those soft slippers that again the doctor sole shoes and all that stuff. They are good till the time you don't have plantar fasciitis, until once your knee is injured, then you need some better form of cushioning. Then you need a silicone heel that soft sole does not suffices. That is what I need to add on. Once you have plantar fasciitis, then add on that heel. Then you can't substitute with a comfortable sole.
Where are these silicone heels available?
Any chemist shop, ma'am, easily available.
And we have a question from Ruchira Jokhakar. In plantar fasciitis, how much time we swim a day? 30 minutes.
As much as possible, ma'am. Plantar fasciitis, swimming is not contraindicated.
Not contraindicated.
Definitely, there is an issue with the barefoot on the hard spool surface, but then that can be managed.
We have a question from Sharda Reddy. I have shoulder pain MRI interstitial tear at level of footprint, tear superior labrum, what movement of shoulder I should avoid and I should do? Can I swim?
Empirically, this is a common MRI report that we receive, irrespective of the actual injuries. So, they need a proper clinical evaluation with these sort of injuries. But as a gross general rule, if a movement during swimming or any exercise causes you pain, that should be avoided. If it's painless, you can go ahead with your exercise for that particular shoulder. I normally either I lean back on my backrest of the chair, or I sit in the anterior half of my chair and sit straight. So my legs are deep inside my desk.
True.
That way, my lower chest is near my desk, and that time I'm always straight. If I'm away from my desk, I'll have a tendency to bend forward. If my body is more into my desk, I'll automatically be straight.
Yes,
That is a trick you can use to keep your, back straight while you're working. And that
do you think you should be using, back support, like a pillow?
The thing is that how often are you able to actually lean back on your chair? I really think that we are able to lean back. Most of the time, we are sitting forward on our chairs. Leaning back is very infrequent, so that back support, whether it's there or not, becomes useless.